Are you one of the millions of people who've been told by someone in the healthcare world that your knees are bone on bone? Well, first off, let's cover off what that actually means. And then also, does that mean that you automatically need a knee replacement? So let's start with just talking about what they mean when they say your knee is bone on bone. Well, when you look at an x-ray, what you'll notice is that there's a loss of space between the upper bone, which is the femur, and the lower bone, which is your tibia. Normally, there's cartilage that creates a gap. So when you look at an x-ray of someone under the age of 20, 25, you'll notice that there's a nice little gap between those two bones. Now, as we age, wear and tear over time, guess what happens? We wear out some of that cartilage. Some of us quicker than others. So what that usually shows on the x-ray is that there's a loss of space and it looks like the bones are touching. So this loss of space is one of the first indicators that you may be starting to experience some knee pain. Now, this isn't an inevitability. Research has shown that people over the age of 40, upwards of 25% of people show a loss in cartilage in their knee, but have no symptoms that accompany it. So what happens when the knee pain matches what the appearance is on the x-ray? There's many things that can lead to knee pain. One of the main ones is overuse or weakness in the muscles around the knee. Now, it's a bit of a catch-22. If you feel like your knee is sore, you're maybe less likely to do activities that cause it to be painful. But when you stop doing activities to strengthen the knees, unfortunately, there's less of a support system around the knee, and you actually end up putting more force into that poor knee joint that is already a little bit damaged. So I'm going to run through a little bit of the research that's out there that shows that physiotherapy can actually really help with knee pain, even if you have severe arthritis, which again would likely be diagnosed in layman's terms as bone-on-bone knee pain. You'll see me looking down just so I can read the article and so I get everything accurate as I go through the next few examples. So let's get started. So there was a journal done in 2014, and the title of it was called Physical Therapy and Exercise for Knee Arthritis. The findings found that physio and exercise was actually effective at managing knee pain, especially for people with advanced osteoarthritis. It helped reduce pain and improved their function. So function really refers to what they can do on a daily basis, whether that's walking, cycling, stairs, things that happen throughout their everyday life. All right, the second journal article was called Physical Therapy as Good as Surgery and Less Risky for a Type of Meniscus Repair, 2013. Now, this one is a little bit more specific to meniscal tears, but it also shows that surgery isn't always the answer when you've injured your knee. Regular rehab can actually be just as effective or more when you strengthen and use the muscles effectively around the knee joint. Okay, our third study is called Physical Therapy versus Glucocorticoid Injection for Arthritis of the Knee. And this study is from 2020. Now, what they found is that physio was superior to the injections for improving function, reducing pain, and that it really should be physio that's the first line in defense of knee arthritis. Okay, I've got two more. Fourth article, Management of Knee Arthritis, a Multimodal Approach, and this is from 2012. So this article discussed the importance of using a variety of approaches, including physio, weight management, medication. Now, it emphasized that knee replacements should only be considered after all of these conservative managements had been considered and trialed for at least 6 weeks. Okay, and finally, I love the title of this one, Physical Therapy for Knee Osteoarthritis. Is it effective? And this article is all the way from 2000, but it was a comprehensive study that took physiotherapy versus standardized exercises and found that physio was more effective in reducing pain and improving function than the other standardized exercise programs. So again, shows that it's a really effective non-surgical approach to managing knee arthritis and knee pain. So I'm hoping that these 5 articles highlight the fact that there's actually quite a bit you can do to manage your bone-on-bone knees, even if you are waiting for your knee replacement or if you're not sure if you need a knee replacement or not. Always start with the most conservative and least invasive approaches, meaning physio, exercise, diet, anything that will give you a benefit of strengthening the muscles, reducing your weight, and making it so that you can engage more in life. And finally, if you do need a knee replacement eventually, there's many factors that you can consider. But if you've already gone through these previous steps of trying to manage conservatively, then you can really make a for certain decision, knowing that you've already done everything you can to manage without surgery, so you can move forward with confidence, knowing that the knee replacement is actually the right decision for you. So never let a surgeon or a doctor say, well, your knees are bone on bone. It means you need a knee replacement. Take a little bit of time, learn how you could better manage your strength, your flexibility, and your activities with the guidance of a physical therapist in order to maximize what you have available. And then after a couple of months of that, if that still fails, then you can move ahead with a knee replacement. I hope this helped give you a little bit of guidance and a little bit more insight into what it means to have a bone-on-bone knee. It's not a death sentence and it's not a final diagnosis. It's just a window into what's happening inside the joint, but there's so many other things you can do to help improve how your knees function.